Look, this is the teaser to Focus on Health. I'm not a bonehead, and this is not Halloween. So I'm going to want you to think about what we're going to be talking about at the other end of this commercial. Welcome back to Focus on Health. Now, I know you couldn't guess that. I know you couldn't, because you know I'm not a bonehead, and it's not Halloween. But to my right here, I have a real good friend of mine, Dr. Muller, who's both a medical doctor, by the way, and a doctor of dental surgery. He has a very, very, very great present for our veterans in the community and individuals who are suffering from PTSD. So, Don, I want you to look into this camera right here and just tell them, first of all, who you are, a little bit of background about you so they know what a heavyweight you are, and what your goal in life is right now. Right in that camera.
Well, I finished dental school, and then I went in the Army for about 20 years. And then I also went to medical school and finished a medical degree. While in the Army, I was an oral and maxillofacial surgeon. As a matter of fact, I was chief of oral surgery at Martin Army Hospital. While I was there, I got an interest in PTSD and the manifestations of it, which is nightmares and continual unexplained headaches and people that can't sleep. And when I got in my private practice, I found that by making a device, I did it on myself at first, and I found that when I wore this thing at night, my nightmares and my headaches and my sleep disruptions disappeared. And as a result, I did a study. It's a case series in my office. People would come in, and I'd ask them. I said, well, you know, how are you doing? Do you have nightmares or headaches? Have trouble sleeping? These are common things. And then we got into the issue of, do you think you might have had a traumatic event in your life? It doesn't have, you don't have to go to war to have PTSD. It's a common misconception. That's right. And you can have it as a result of sexual trauma, or a friend has died, a very close friend unexpectedly.
Any traumatic event.
Any traumatic event. And then I realized that there was something to this, that these people were grinding their teeth at night. And I did that. And I said, wait a minute, there's a connection. And it's revolutionary, and it's totally unexpected that we would get this result by wearing this device, which looks kind of like a basketball or football mouth guard. It's very specialized, that's going to be able to stop all this stuff. And I was amazed, because I'm a surgeon, and I normally cut things to make them better. But this is a whole new venue. And so I retired from oral surgery about 6 months ago, and I bought an office that's strictly used for the treatment of PT.
This here.
Yes, sir.
And see, this is what I like about Don. I know Don, by the way, but we've been friends a long time. It's not about money for him. It's about taking care of, first of all, his interest in vets, because he is a vet who suffered from PTSD. The second thing is about helping people who have manifestations of post-traumatic stress disorder, part of which is the bruxism, which is grinding teeth. Now, what I want you to do, Don, I want you to take this here and just explain to them so they understand the correlation between the bruxism, or the grinding of the teeth, and the muscles and all here. So we're going to fixate on this head right here while Don is explaining it.
The thing people don't understand is that PTSD is not just a disorder of the mind. The mind controls the body. PTSD folks have high blood pressure, they can have increased incidences of diabetes and other medical disorders, and actually have a shortened lifespan. Right. So one of the manifestations of PTSD is the fact that you clench a lot when you're asleep at night.
Yes.
And the muscles, people don't understand, but in your head, there's a big muscle here. There's about 8 or 10 at least muscles of mastication. You chew your food.
Right.
This is one of them. So when you feel your head and it's kind of tender, something might not be right. Now, another muscle down here in blue is the masseter. If you bite together and you feel that muscle, you can feel your leg, and you can push on that and it doesn't hurt. But when you push here, it's a little tender.
Right.
You can push behind your jaw and it's tender. That would be here. And then there are muscles inside your mouth that you probably don't want to try that right now with a dirty finger.
Right.
But when you visit the doctor, he can feel these trigger points inside your mouth.
Right.
And when you have nightmares and you have headaches when you get up in the morning, and you can't sleep, and you put this together, this is an oral manifestation of this disease. Now, there was a recent book called Stress and Orality, a very comprehensive text that ties this all together. When you've had PTSD, your brain is what we call upregulated, and the nervous system is on edge. And that causes the trigeminal nerve, and we're not going to use a lot of big words, but that's the nucleus that controls your bite so you don't break your teeth. That nucleus is upregulated, and so you're always stressed and clenching. And that's the mechanism of why this kind of tones that down, cools it off, so that the nightmares and headaches go away.
Now explain this, let's go with this here, because then we're going to go into the slides, but I want them to have a basis of what you're talking about now.
Well, what we do
is hold the model so that they can see.
We do not, in our office, probe or poke or draw blood.
None of that stuff.
None of that stuff. We go in your mouth and we take a mold of your mouth.
Try to hold it up. You want me to try to assist you?
Yes.
Yeah. Okay, here we go.
We take a mold of your lower jaw, and then we make a model. Then in my office, it's a same-day visit. We fabricate this device. It looks like a mouth guard, but it's not. Then we put it in your mouth, and then when you bite down,
see?
It's that cushion.
It's that cushion.
And we test it out before you go home.
Right, to make sure. See, so, and that right there releases that clenching, that stress that you're clenching at night that you don't even realize that you're doing.
Exactly.
That you don't even realize you're doing. That's causing the problem and the muscles and all there like that.
Absolutely.
This is really, what Dr. Moeller has here is really, really, really revolutionary. And this is what I like about it. It's also personal with him. Him being a PTSD sufferer, a veteran, and wanting to make a difference. So much, in fact, that he went to the seminary. This is a mission for him. It's not about money. It's about doing something from his heart, spiritual. So, okay, so now what we're going to do, Don, we're going to jump into the slides because we got a lot of them. And so let's go to the first slide now. All I want you to do is just to describe, it's a lot of technical terms, but to break that down just into layman's terms for them.
Well, this looks like a mouth guard for a sports event, but imagine that I put a rock in your shoe to make you limp every time you walked in your right shoe. Well, that rock is a rock, but it's now also an orthopedic device.
That's exactly right.
I can get you to step completely different than you would if that rock wasn't in.
That's exactly.
Is that a rock or is that a medical device? If you leave it in long enough, you're going to have hip and back pain. So this is that rock becomes a medical device.
So basically we have a description of a removable intraoral neuromodulator device with a reduction of headaches and nightmares and post-traumatic stress disorder and traumatic brain. Basically what that's saying is that this device is going to alleviate the bruxism and the clenching of your teeth that's causing the problems. Let's go to the next slide. PTSD is a complicated disorder. The diagnosis from DSM-5, which says previous exposure to a traumatic event that actually threatened the physical integrity of the individual or was so perceived by the person and evokes a response such as fear, helplessness, or horror. That's basically what PTSD is. Let's go to the next slide, please. Okay, let's go to the part where it says, among Vietnam War combat veterans, the National Institute of Mental Health indicates that 20% has struggled with symptoms of PTSD within 20 years of their military service. You and I have come into many veterans after the Vietnam that are still, yeah, please comment.
You don't have to have been in a battle as an infantryman.
That's true.
To have PTSD. You may have been a rear echelon troop in grave registration.
And still had the stress of the condition.
Or a medic or a military policeman. So you just need to understand that
it's not just with combat vets.
Not combat vets.
That's right. And in fact, you know what it could be? It could be somebody who was involved in a horrendous motor vehicle accident.
Absolutely.
Have the same
sexual trauma.
Or sexual trauma.
Absolutely.
Right. That's exactly right. Okay, let's go to the next slide, please. Okay, early estimates of PTSD among Operation Iraqi Freedom, Operation Enduring Freedom, published in the American Journal of Psychiatry, were approximately 12%. What we're doing, we're just giving you stats military, because this where Dr. Moeller sees so many of the combat vets, but we could also give you statistics of everyday citizens who were involved in sexual trauma, motor vehicle accidents, unforeseen circumstances in life that cause extreme fear and trepidation in their lives.
That's true.
Next slide, please.
That's absolutely.
Okay, let's go with this one. Explain this here, Don.
Well, the headaches and muscular disorders, this is not just TMJ. I want to make that perfectly clear. If you had a whiplash injury and you have clicking and popping, that's TMJ.
That's TMJ.
This is not TMJ. It can manifest as a TMJ symptom from the incredible stresses that you put on your jaw.
On your jaw, clenching.
Yes. And what this device does, you will still clench your teeth, but the space that we put between your teeth,
it's like a cushion.
A cushion, and it prevents the feedback, the pain feedback. It changes the nature. Essentially everybody dreams, but what happens in this case? It turns your dreams into nightmares.
Right.
And so you, out of your control, the clenching will take a pleasant dream, and now you have a horrible dream. Right. And so this prevents the pain. We're not real positive of the neural mechanism, and it doesn't matter because it's established that it is a neural mechanism. We can't explain exactly why it does it, but it absolutely does it.
Yeah, what is so significant is that when you're asleep, you're completely unaware that you are causing that nightmare because of your clenching of your teeth and the pressure and the pain through your temporal mandibular area.
Yes.
You're inadvertently are changing your dreams into nightmares just from the pain of that sensation.
Absolutely.
And so what this implant does, it widens the gap and causes less of a pressure on your temporal mandibular and less pain, which redirects your thought mechanism and your pain.
And
that's the mechanism that we're trying to describe to you right now, that this oral device in your mouth, and you're going to see it a little bit on the screen, does. Go to the next slide, please. Okay, I'd like to discuss the statistics, because mathematics is only pure science. The participants in this study, N76, were limited to patients with PTSD diagnosis, had been established for a minimum of 3 years by clinicians in either the U.S. Army or the Veterans Administration, and who had no recent changes with respect to headaches, nightmares, or disorders of initiating and maintaining sleep. Next slide, please.
Can I comment on that?
Yeah. You want to go back to that slide and comment?
Well, I'd comment now. I want to let the folks know that over 400 people now have experienced this.
Oh, have been in the study.
That was one of the first studies, but now we've done sophisticated.
So now you've done over 400.
Over 400
who have manifested that this works.
Yes.
That's awesome.
Yes, 400,
That's awesome.
And I want to assure you that this, to do a real research study, you have to have an institutional review board.
Sure.
And we had that. And for both of our short-term and long-term studies, so this is actual science. This is not.
No. This is not shooting in the dark.
No.
This is something that which it can be statistically proven.
And also, the important thing is every single one of these patients that I treated had failed previous treatment was.
Oh, wow.
It doesn't mean that psychotherapy doesn't help you. It doesn't mean that some of the medications, you can have breakthrough nightmares,
of course,
breakthrough headaches, and breakthrough sleep disruptions. It's a team approach. Right. But if you're still experiencing
this is just an adjunct that will go along with everything.
Yeah, this is not a one-step cures everything. If you can't sleep, you can't get rest, you can't really work with a psychotherapist at the same level that you could.
That is exactly.
If you got a good night's sleep.
That is exactly. It's all of these things combined, but this is a vital part of it.
Absolutely.
Let's go to the next slide. Explain this, where you see it's equal among males and females.
Yes.
Post-traumatic stress disorder.
It's
not determined by sex.
No, sir.
Okay, next slide, please. Explain this here.
This pie diagram shows it's an all age. You can be in your 20s, 30s, 40s, 50s, 60s, or 60s.
It still manifests
yes.
as sort of a PTSD.
And depending on the group you're dealing with, this diagram will change. But this shows that you can have PTSD effects whether you're a vet from Vietnam or Iraqi,
or a civilian involved in an accident,
a traffic accident. Or
there we go.
Yes,
there we go. Next slide, please. Okay, explain this right here, Don.
Well, what's going on here is we're seeing that the splint is the basic point is that it's a technical description of what we're doing, and
right.
And so we can kind of move on. That it was basically to prevent the feedback mechanism, and that's what that slide says.
Okay, next slide, please. There we go. This gets to the nitty gritty.
Now
explain this here, because this is a visual example of what we're talking about.
This is me. It's your chance to look at a dentist's mouth.
Okay.
And any rate.
Before the splint now, note the significant overlap of the maxillary anterior teeth over the mandibular teeth.
Yeah, the upper jaw is over the lower jaw. In this case, you may not have exactly this view when you look in the mirror, but if you can have this, and so we're going to show you next what the splint looks like.
Now that's the splint.
Yes.
The mandibular soft stabilization splint on dental stone model.
Yes.
Okay. Now that is what will be placed in after measurements. Dr. Moeller makes the measurements and whatever for you.
Yes.
Okay, let's go to the next model.
That's what it looks like in the mouth.
So you see the difference, that there's not any overlap. In fact, it's a significant separation between the maxillary and mandibular.
Upper and lower jaw for the folks.
Upper and lower jaw.
Yeah.
And you could see where it would cushion and lessen the grinding of the teeth, the bruxism.
The effects of the bruxism
The effects of the bruxism on the brain, the muscles,
yes.
and the stress and the pain that the patient is experiencing while they are sleeping.
Yes.
Which causes the nightmares.
Which wakes you up.
That's exactly.
Your heart to race.
Yes.
I've had veterans and other people that wake up they can't remember their nightmare, but they wake up crying. With their heart racing.
Yes, blood pressure high.
Yes, you had a nightmare.
That's exactly. But even though they don't remember
absolutely.
They've had that.
Yes.
And so it's really significant that this device, because it lessens that sensation, the actual physical exertion of the temporomandibular muscles causing the pain, that this device, look at the aperture.
Yes.
That something like this here could lessen the symptoms of PTSD. We're going to stop for a minute right here. We're going to go to a commercial, come back with the rest of this good information.
All righty.
See you on the other end of the commercial.
Bicycles are fun at any age. Just remember the rules of the road when you're out enjoying a bike ride. And motorists, when you're sharing the road with cyclists, use caution and give at least 3 feet when passing. Bicycles are safe, fun, and sensible. When you ride, be visible, be predictable, and be alert. You'll have a safe ride and a great time. Let's get there together, Georgia. A message from the Governor's Office of Highway Safety and Georgia Bikes.
I am a teenager.
I am online.
I enjoy sharing thoughts,
music, videos,
ideas, information.
I will not
be a victim to threats,
to stalking,
to soliciting,
to predators.
I will be responsible. I will be careful.
I will be honest.
I will be smarter. I will get my parents involved.
I will protect myself.
I will be safe.
I am a teenager.
And I
will not
be bullied.
Welcome back to Focus on Health. We're here with Dr. Moeller. Dr. Moeller, now, what I want you to do, before we go on with this good information, I want you to look into the screen and give all your contact information, how people can contact you if they want relief from PTSD. So you look right into that screen and tell them.
We are in Rosemont, like little medical complex on Rosemont Drive. It's 3916 Rosemont. And our telephone number is 706-323-1852, 706-323-1852. And when you come in, more than likely, you will be the only person in the office. No one knows that you're there for PTSD. It's a very sedate,
confidential,
very confidential area. It's not high traffic area. And you come in, there's not going to be any pokey blood drawn, anything like that. It's not necessary. And you're just going to be filling out some basic information. We take a mold of your mouth, then while you're completing your information, then I may actually make the device, the neuromodulator, and then we test fly it for about half an hour before you leave.
It's easy.
Yes. There's
no pain.
And I need to tell you that it's a money-back guarantee. And I'm only doing this to make sure that there's really no reason you can't come in and get one. Well, the charge we have is extremely minimal, and it's just to make sure that you take it seriously, and that if it doesn't work, you'll come back and
the main thing is you're not out there to make money.
No, a money-back guarantee.
You are there as
Absolutely.
a person, as a PTSD sufferer
Yes.
to relieve. And
Absolutely.
this is your mission in life.
Yeah, money back, you don't get that.
And basically, that's why I know Dr. Butler, we've been friends for a long time. And when he decided to go off into this here, you know, it just touched me because this is his mission. Okay, let's get back to the next slide, please. Okay, just explain this here. Just
these are exciting
statistics.
The next slides are going to show that we have treated tough patients. This is a pain scale, and it's a standard pain scale. If folks take this and want to freeze frame it, you can look it up. But it shows on the right side, the number, those are high scores for pain. Those are significant. Those are life-altering pain scores that say, hey, I got a headache, I can't work, I'm feeling bad. So that's what that slide says, is that our customers or patients we're
really
affected.
sufferers, we're really affected.
We're really affected. These were not easy cases.
Let's go to the next slide.
Now this is the duration of symptoms. In PTSD, the symptoms can go on for years and years and years. But if you treat someone with PTSD that say, I've had it for a month or two, well, you may get spontaneous resolution. But all these cases, if you look at the numbers on the bottom, it says those are years.
Those are years. That's significant.
Yes, it starts with 3 to 5 years, and you can see down there, and then it goes all the way up to people who've had PTSD and nightmares for 30 and 40 years.
Which is we see among vets, is something like
yes.
that common. Next slide, please.
Now this
headaches per week.
This shows you there's people that have 3, 4, and 5. Those are the numbers. This is a breakdown of statistics, and it's the same percentages in the 400 patients that I've treated. But look over there on the ones that have almost 7 headaches a week, or
That's
headaches
awesome.
that don't. These people are hurting.
They're really hurting. And then when you figure the fact, the interruption in their rest,
yes.
that they can't really rest, and then
yes.
throughout the night it's going to raise their blood pressure up. Individuals who have significant problems with diabetes, it
yes.
affects that,
yes.
and all those other things. Let's go to the next slide.
This is disturbing
dreams and nightmares.
Yes, I want to thank a professor at the Medical College of Georgia, where I used to be a professor. He said, use this, we call them inventories. And this inventory shows the number of disturbing dreams and nightmares. So you can see that these folks are having nightmares between 3 to 7 times a week when they go to sleep. Even if you don't remember your nightmares, if you start to remember them, you can categorize it. It's like, yeah, I just woke up, I had a horrible nightmare.
Right.
The average patient that I see has between 4 to 5 nightmares a week. And
That's
now some,
awesome.
every time you fall back to sleep, you have another nightmare.
Sure, that's awesome. Next slide, please.
This is
nightmares per week pre-treatment.
Pre-treatment. So this shows the distribution in our sample that shows a whole bunch of folks had a whole bunch of nightmares. This wasn't atypical.
Right. Next slide, please. Okay, some patients were more comfortable indicating their improvement through words, not through numbers. For the purpose of this presentation, the following legend should be applied. Okay.
And this is important because you can't see a headache. You cannot see a nightmare, and there's no basis to measure it without incredibly sophisticated and expensive technology.
That is correct. Next slide.
Now this is the one I love. Nightmare improvement, gone, 49. That's massive.
That's awesome.
Yeah, and this is the patients telling us they're gone. You know when you have nightmares. I know, and they're very dramatic nightmares. You feel you're back in the war zone. The rest of them, much improved, is like better than 80%, much improved and very much improved. You can see them down on the
what
bottom.
is significant, this is when you had 76. Can you imagine your figures you had when you had 400?
Yes, yes.
Just looking at this right here.
The same figures are borne out percentages with a large-scale study.
This is awesome. Next slide, please. Sleep improvement, 24 hours post-treatment. Look at that.
Very much improved.
Yes.
Patients say
that's significant.
Absolutely.
That's
There's
significant.
no doubt.
So you see, this is a direct statistical relationship between what the patient is experiencing and the oral device.
Yes. Yes.
Next slide, please. Sleep improvement, 30 days post. Look at the improvement.
Yes, and this is
Awesome.
durable. We have finished our long arm study, and we found that this lasts for years. You may wear this down, and when you wear it down, it's not a placebo. When you wear this device down,
you've got to come back.
You've got to come back. Some people, I wear mine down in about 6 months, but we have most of our patients take about a year or two to wear theirs down.
And it just come back. It's just like anything else that you might wear for an arm or something like that. It's not forever. You have to go and get it replaced and buy another one.
Yes.
Next slide, please. Headache improvement. Great. Awesome.
Gone.
Out of the 7640s. Look at that.
And this is really important because it shows you have been getting good treatment. Your doctors are trying very hard to control your symptoms. But if the major symptoms are being controlled by your jaw, then
you need to address that.
You're on the right track when you're using this.
That's exactly. Next slide, please. Okay, headache improvement. Oh, times 30 days post-treatment.
Yep.
Look at that.
Gone.
Gone. Next slide, please. Okay, overall improvement for, what is it, 22 traumatic brain injury, PTSD patients?
That's another thing I want to add. PTSD and traumatic brain injury go hand in hand.
Right.
And so if you've had traumatic brain injury, you may also have had PTSD and most likely have. And this has a significant effect on those folks with PTSD and mild traumatic brain injury as well.
Sure. Next slide, please. Okay, explain this. This is obvious. Bruxism, dental pain, induces masticatory muscle pain. What this is saying is exactly what we explained before. When you're sleeping and you're clenching your teeth, it causes the pain in the temporomandibular area that you're completely unaware of while you're sleeping, which causes you to have nightmare, lose sleep, toss and turn, and all the other symptoms that you experience. What I like about this here is the increased split material may act as a cushion to alleviate all of that discomfort by promoting muscle relaxation, which may contribute to reduced frequency and or intensity of headaches. The effect is probable behavior that is unconscious. Yeah, so you're unconscious doing all these things, and the split just lessens all of that. Next slide, please. Okay. The military PTS participants in the studies all had previously undiagnosed
masticatory muscle trigger points.
Right. This suggests that palpation for muscular muscle trigger points should be included in routine military physical examinations, and a lot of times it's not.
No. The main thing is that when we showed you the skull and where it hurt, when you feel up here, you feel behind your jaw if that's tender, under here, and you feel your masseter right here, especially if you bite down, and you
can actually feel it.
You can feel that.
You can actually feel that muscle.
And then if those are tender, there's a high probability, and you're having headaches, there's a high probability.
That there's a correlation.
Yes.
And this is something, would you explain, and this is important to Dr. Moeller, would you explain, this is very important. Can we have a shot on Dr. Moeller, by the way? Can we do that? Now, explain that again to the people, because they need to check, because that's extremely important.
Push like on your stomach. That doesn't hurt. You can push quite hard. Right. When you're pushing here and you're rubbing around and you're feeling this tender soreness, that's not supposed to be that way. And then there's certain exquisitely tender areas behind here. You may have tenderness behind your neck or on your shoulders. You may be tender right in here.
Where you clench here.
But when you start working this big muscle that we use to chew with right here, when you work your finger along like this and you're tender up there, sometimes it's really tender and you're having nightmares and you're waking up with headaches.
There's a significant correlation.
Yes.
And that's what a lot of people don't know. We're going to take a break and we're going to come back to sum all this up right after this next commercial.
I volunteer.
Step up. I volunteer.
Go. I volunteer.
We volunteer.
And I volunteer.
Hi, I'm Sally Goins, the volunteer coordinator here at Columbus Animal Care and Control, and we would love to have you come and help make a difference. If you're interested in volunteering, please call me at 706-225-4666 or email me at animalcontrol@columbusga.org.
Welcome back to Focus on Health, and I want to thank you for bearing with me because this is the after effects of the flu. I'm not contagious, but got that lingering cough. Dr. Moeller, look right in here and tell them, first of all, how they can get in touch with you, when they can call you. I know you do it by appointment because this is your special application. You're not about making money, you're about helping people. So give them, I want you to do it twice into this camera, how they can get in touch with you.
My telephone number is 706-323-1852, 706-323-1852. It's in Rosemont, on Rosemont Drive, 3916, small office. There are 2 oak trees all around the parking lot. You'll feel welcome when you come. We schedule your appointment when you call just for you. We do not, I have a lot of other things that I'm doing. So when you call, we will work you in, probably see you within that week or the next week. And whatever time is good for you, our appointment staff will get you in.
And touch the fact that it's confidential, because a lot of people have a,
oh yes,
they feel upset because, oh, I got paid. It might be medical. No, it's not. It's physiologically,
yes,
we find out based, so it's confidential.
You need to know that I would be more surprised if anybody else was in the waiting room than you would be. There's no sign on the door. It just has my name. It's none of anybody's business, and there's nothing that labels that office as doing anything.
I want people. I want people. There's no stigma.
No stigma at all. And if you have a service dog, bring them.
Yes.
Bring your service animal. We love them. You're not going to get any hassle about that, except we might pet them.
Let's go to the next slide. See what we got. A definitive analysis of the underlying physiological mechanisms producing the therapeutic effects obtained by the splint is beyond the scope of the report. Basically, what that's saying is we know the device works.
Yes.
Next slide. Okay, in this study, it was a population previously diagnosed was found to have unrecognized
trigger points, yes,
and unrecognized bruxism. That was what we would explain to you before. A lot of people don't even know that they are predisposed to have this, but because of the tenderness, and they don't really examine themselves. Next slide, please. Okay. What this is saying, that there were therapeutic effects produced by the slide. It was improved sleep, quality of sleep were noted by self-report at varying times throughout the study. So these effects reversed when use of the splint was discontinued, which is what Dr. Moeller was saying. You had this, you've got to, you know what this is like? It's like people with sleep apnea. You're going to always have sleep apnea, so you're going to always have to use the mask. It is exactly the same thing. Basically, I want to take the next couple of minutes, Don, to just to let our viewing audience know that you are a man of God, and this is another step in your life. You've got your military career as an oral surgeon and a physician. You came out and you did oral surgery at your practice for how many years?
20.
For 20 years. And just like with me, when the good Lord tapped me on the shoulder and said, stop making the money at the medical center and just start focusing in on using your skills, your education, and your experience to help people in the community. The ways of God, they sound, there's a thing in the scripture that says that the foolishness of God is greater than the wisdom of man.
Yes.
And when I told my wife I was going to stop working and start doing free, she said, what? But she's a good woman, and she stood by me, and look where I'm at today. Look how many people I've helped. He's in the same position in his life right now, where the only thing he wants to do is what the Lord is directing him to do. You're a friend, Don.
Thank you, sir.
And you want to know something? We're going to make sure more and more people are aware that there is a resolution for PTSD.
And it's simple and it's
And it's
easy.
simple and
without
it's easy.
being and
No pain, no blood, no nothing.
only gain. And if it doesn't work, get your money back.
That's exactly right.
At least I've met a new
person.
Columbus friend.
So you cannot beat
You
something
can't
like
lose.
this here. Last time, look in there and tell them how to reach you. Last time.
706-323-1852, Suite 3916 Rosemont Drive.
Dr. Moeller, Don Moeller. Don, I want to thank you.
Thank you, sir.
Thank you for coming, and for all of you there, as always, I love doing this program. This is one of my particular missions. I'd like to thank Mr. Mike King, and Mr. Bruce Lee, his assistant, and the government, the CCG government, for allowing this program to go out to the community and educate individuals on health. It's a real blessing for me, and I will see all of you again next month. God bless you.